This patient, like millions of others each year, will be undergoing an invasive procedure. However, this patient is carrying an infectious organism, and the medical devices that are so critical to his successful outcome will eventually be reused on another patient, potentially spreading pathogens to others. As a member of Central Service, your primary goal is to prevent the spread of microorganisms that can cause disease by ensuring that all medical devices and instruments used in these procedures are properly cleaned, disinfected, and sterilized. Many departments will depend on you in order to deliver quality patient care. In the healthcare setting, the most common sources for transmitting infectious microorganisms such as HIV, hepatitis C, or emerging pathogens like C. difficile are from human to human due to poor hygiene and improper hand washing, and surface to human, such as through improperly cleaned instruments, equipment, or surfaces. It is the responsibility of the Central Service professional to ensure that the equipment and devices used on patients are free of pathogens and are safe for patient care. This begins by consistently practicing standard precautions. Hand hygiene, using alcohol-based hand rubs or soap and water, is the most effective method of preventing the transmission of infectious pathogens. Central Service technicians should cleanse their hands whenever entering or leaving the work area, whenever hands become soiled or contaminated, and before donning and after removing personal protective equipment. If your hands become soiled or contaminated by blood, body fluids, secretions, or excretions, you should wash your hands immediately with antimicrobial soap and water following the CDC recommendations. Another important aspect of standard precautions is wearing the appropriate personal protective equipment to avoid exposure to infectious agents or chemicals. PPE may include a hair cover, general-purpose utility gloves, a liquid-resistant covering with sleeves, high-filtration efficiency face masks, eye protection such as goggles or face shields, and shoe covers. The exact type of PPE you wear will depend on the type of work, the infectious materials or chemical agents you may be exposed to, and the anticipated duration of exposure. Change your PPE when it is grossly contaminated with blood or other potentially infectious material, or as designated by your facility's protocols, and remove gloves that become nicked or torn.
The most important thing to remember when removing personal protective equipment or PPE is to not recontaminate yourself. What you're doing essentially is peeling a layer of protective gear off that has potential to cause infection. And so you want to pull that off very carefully and in a prescribed order so that you don't recontaminate your clean scrubs underneath.
There are also many safe work practices that will prevent the spread of infectious microorganisms and protect your safety. Because healthy skin is the first line of defense against microorganisms, report any irritated, broken skin, or open wounds to your supervisor. Eating and drinking in restricted and semi-restricted areas is never allowed. Avoid rinsing under running water. Instead, clean items under water level and use a second sink for rinsing whenever possible. This will prevent aerosols and minimize splashing and spraying that can cause microorganisms to enter your eyes, nose, or mouth. Disinfectant and sterilant solutions are designed to kill microorganisms and so must be used following proper safety precautions and only for the intended purpose.
Material safety data sheets or MSDS sheets are critical to anyone who works in Central Service because we work with a large number of chemicals, and a material safety data sheet tells us how to handle those chemicals. It tells us if there's any dangers, it tells us how to work if we have a spill or an exposure, and it helps us to work with those chemicals to keep us safe. And everyone who works in Central Service should be familiar with all of their material safety data sheets.
To further reduce the exposure risks associated with the use of chemicals, follow manufacturer instructions precisely to properly dilute, mix, store, and dispose of the agents you are using. Never combine chemicals unless a product requires a catalyst or activator to be mixed with it. Participate in your facility's spill plan so that you know how to contain, neutralize, or clean up a spill of chemical disinfectants and sterilants, and report all possible exposure to pathogens or chemicals immediately to your supervisor. Be familiar with the policies, procedures, and regulations for how to safely collect and handle regulated medical waste during cleaning and processing. Regulated medical waste may include sharps, such as sutures, needles, and syringes. Selected isolation waste, such as biological matter from patients who are under isolation precautions. Pathological waste, such as tissue, and blood, blood products, and body fluids. Finally, many central service positions require lifting, pushing, standing in one place, or repetitive motion. Ask your supervisor or safety officer about safe ergonomic principles that will reduce strain and the chance for injury. The environment where cleaning, disinfection, and sterilization is performed is designed to prevent the spread of infection. For example, a formal central service department may be physically divided into 4 areas: decontamination, preparation and packaging, sterilization, and storage.
As you would imagine, in central service, there are 2 things we're dealing with. We're dealing with 2 opposite areas, one that is contaminated or very dirty, biohazard, and one that is sterile, that needs to be completely clean at all times. And so we have to keep our environment around us clean from a safety standpoint and decontam, and also just to maintain the sterility of products. As a CS person, I would be expected to or required to keep my environment clean. Some of those jobs, such as cleaning the floors, the walls, the ceilings, may be done by environmental service staff, or they may be done by CS staff. It really depends on the facility. Handling sterile products, cleaning racks, shelves, and cupboards and carts is usually performed by the sterile processing or the CS staff.
To further protect the integrity of the environment and prevent microorganisms from being carried from one area to another, you will be asked to follow and enforce specific traffic control patterns. There are 4 areas within central processing that require specific types of PPE. Biohazard areas may have contaminated equipment and instruments and require the appropriate PPE per OSHA. Unrestricted areas include normal traffic areas, such as equipment rooms and locker rooms, and do not require PPE. Semi-restricted areas include clean assembly and sterile storage areas and support areas for the OR. These areas require surgical scrub and hair coverings, and restricted areas, where sterile procedures are performed, require surgical scrub attire, hair covering, and a mask. In addition to following infection prevention and safety measures put forth by your facility, central service staff must develop a working knowledge of cleaning, assembly, and sterilization processes and quality assurance measures to assess outcomes. To begin, a properly designed workflow of the central processing department ensures an efficient process from decontamination to storage and avoids cross-contamination between these steps. Soiled and contaminated items enter through the decontamination area, where they're made safe to handle. Clean items then enter the preparation area, where they are prepared and packaged for high-level disinfection or sterilization. Once items are disinfected or sterilized, they are placed into sterile storage, where they remain until used. All medical instruments and devices are considered contaminated when they are used on a patient. They are opened, whether or not they have been used, are dropped, even if there is no noticeable damage, and when they enter the decontamination area. Medical instruments and devices that are new, repaired, refurbished, borrowed, or loaned are also considered contaminated and must be examined, cleaned, and sterilized before they are used. When transporting items to the decontamination area, use an enclosed cart and wear the proper PPE to protect yourself and prevent cross-contamination. The cleaning process removes foreign materials such as soil and organic matter from objects. It is the first and most critical step in breaking the chain of disease transmission. If an item is not properly cleaned, it cannot be sterilized. Items are cleaned manually or processed through a mechanical cleaner or a combination of both. The method is determined by manufacturer recommendations for the device, as well as the type of procedures performed at your facility. The selection of cleaning agents should also be considered.
Some people believe that all cleaning agents for medical devices are the same, and they're not. And so it's important to consult the manufacturer's instructions and also the regulations within your facility to ensure that you select a product that will do the job and will not be harmful to the item that you're cleaning.
After cleaning, the item is thoroughly rinsed, dried, lubricated if indicated, and inspected for cleanliness and proper function. If it passes inspection, it is prepared for high-level disinfection or sterilization. High-level disinfection is a process that eliminates many pathogenic microorganisms except bacterial spores. The most common type of high-level disinfection in the hospital setting is chemical disinfection. Chemical disinfection immerses an item for a specified amount of time in a chemical agent, such as glutaraldehyde, orthophthalealdehyde, and hydrogen peroxide. Sterilization, on the other hand, is a process that destroys or eliminates all forms of microbial life, including spores, by physical or chemical methods. The two types of sterilization most commonly used in the hospital are high-temperature sterilization, which utilizes steam or dry heat, and low-temperature sterilization, which includes ethylene oxide, gas plasma, and ozone. The level of processing required is based upon the nature of the item and the manner in which it is to be used, according to the Spaulding classification system. For example, semi-critical items come into contact with non-intact skin or mucous membranes, such as reusable flexible endoscopes, respiratory equipment, and anesthesia equipment. Semi-critical items require high-level disinfection. Whereas instruments or objects introduced directly into the bloodstream or other normally sterile areas of the body, such as surgical instruments and implants, are classified as critical items. Because there is a high risk of infection from contamination, critical items require sterilization. Sterilized items must be packaged properly in order to allow the sterilant to effectively enter and exit the package and protect the contents from contamination so that the package maintains its sterility.
The concept of time-related or event-related sterility is probably not as hard as it seems. If I can use a quick analogy here, it's like a carton of milk that you have in your refrigerator that probably has an expiration date on it. But if you take that milk out and leave it on the counter, it will spoil even though the expiration date goes farther. And the same thing happens with sterile goods. Sterile goods may have an expiration date, or they're also susceptible to any event that may happen to them. Events that we worry about in central service would include coming in contact with moisture, being handled roughly, maybe a package tear or a package that was opened, a puncture. Those are all things, even soil on the outside of a package, are considered events that will contaminate a package.
When handling sterile items, always do so with clean and dry hands. Do not squeeze or compress packages, and be sure to hold them away from the body so as not to contaminate them. To remove a sterile package from the shelf, lift the front of the item from underneath with one hand and place the other hand midway under the package. Then lift the unit off the shelf so the package is not dragged or pushed. Ideally, sterilized items should be handled only 4 times. When removed from the sterilizer cart to storage, from storage in order to transport to user areas, from transport container to storage in user areas, and when removed to be opened. The longer items are stored, the more likely they will be compromised. Therefore, sterile packages should be arranged by a first-in, first-out system, and items with expiration dates should be organized so that items that expire the earliest are used first. And finally, transport items in a manner that preserves its process status. For example, when transporting items from the sterile storage area to the point of use in patient care areas, covered or enclosed carts should be considered. Keep all shelves on the cart clean. Central service is the center. the heart of infection prevention practices in a healthcare facility. The goal is to prevent the spread of microorganisms that can cause disease. Because your position affects so many people, it is imperative that you do your work consistently, efficiently, and effectively each and every day. The safety and well-being of our patients depends on you.